Some breaking details about preparations for coronavirus coming out just now. North Carolina's coronavirus task force reiterated today the risk is low for the virus here, but that we all need to take precautions. This 24 hours after the CDC said it's going to come to America. They have no doubt. It's just a matter of when.
We are asking the American public to work with us to prepare in the expectation that this could be bad.
For months now, other countries have fought this new and rapidly spreading virus, and now we're seeing our first real concern and change locally in case there is an outbreak here.
The CDC urging schools and daycares to make sure they have an action plan just in case. And Channel 9's Greg Suskin is live for us tonight in Lancaster County, where the schools are letting parents know that they're on top of this. They are working on it. Right, Greg?
Yeah, that's right. In fact, I've learned that before the end of the week, Lancaster school officials and their medical staff will meet here to try to come up with some kind of plan just in case the coronavirus is ever discovered here. This is a screenshot of the Facebook post Lancaster County Schools posted for parents last night for this reason.
I think we'd be remiss if we didn't start looking at things now and making plans about how we would deal with things.
That's School Safety Director Brian Vaughn, who says the district is just responding to the CDC alert that the virus is likely to spread. The students who filled these desks are close together for most of the day, and anyone who's sick can easily infect others.
We do have so many people in close proximity to each other. I think that's why it's especially a concern.
There are still only 14 confirmed cases of the virus diagnosed in the U.S., but the CDC is pushing preparations now. People with children and grandchildren in local schools are already concerned.
I'm worried about it. You know, kids can get anything.
I'm probably going to take them out and put them back at homeschooling again if anything about it starts spreading.
Lancaster schools don't know yet what kind of plan they'll decide on, but say the meeting will likely focus on prevention, updating cleaning procedures, and whether or not schools could close if there's an outbreak. A check to see if other school districts are doing their own preparations. Fort Mill responded with this statement. Our district continues to monitor the situation. We will work closely with our contacts at SCDHEC to stay informed of any developments of confirmed cases in the U.S. and implement any recommendations or guidelines from the CDC. And also, Chesterfield County Schools got back to me today as well and said that all their school nurses are reviewing plans when it comes to infectious diseases and also paying attention to any new alerts from the CDC. Erica?
Thank you. I know you'll keep us updated out there. We are also in touch with the Charlotte-Mecklenburg School District, where officials there told us today they are waiting on guidance from the state before they come up with a plan. Union County Schools met today saying they will monitor travel requests from schools, make sure nurses get regular medical updates as well. Iredell Statesville Schools also planning to meet about all of this. So now let's talk about a possible vaccine. Health officials say they're still 1 to 2 months away from a phase 1 trial of a possible vaccine. So again, a trial, that's just the very beginning. So at best, they say we could be looking at a year or more, a year to a year and a half before a vaccine could be ready. North Carolina does have this helpline. If you have any questions, any concerns about this, like what the symptoms would be, where to go, how to get help, the number to call is 1-866-462-3821. It is staffed by medical professionals 24 hours a day.